pledge will be led by the gentlewoman from Texas, Ms. Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time then for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Eddie Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Eddie Bernice Johnson.
Hello and welcome to the Capitol Report. Today I will be discussing an area that's very close to my heart, nursing and healthcare policy, with Janet Haebler of the American Nurses Association. Ms. Haebler received her undergraduate degree in nursing at Russell Sage College, and she holds a master's degree in nursing with a concentration in administration from Seton Hall University. In her career, she has worked in acute and long-term care, managed care, academia. She is currently the Associate Director for State Government Affairs with the American Nurses Association. That's a very important position. The ANA represents the interests of 2.9 million registered nurses in the United States. We could use at least 500,000 more. I want to thank you for joining us today, and I'm delighted to have you.
Thank you. I'm pleased to be with you.
Tell me just how critical the nurse shortage is.
It's very critical. We've had a shortage for the last several decades, but what's interesting about this particular one, it's almost like the perfect storm. We have a growing demand, we have an aging workforce, and it's all coming together at the same time, and a shortage of graduates as a result of a faculty shortage, again, partly because of people aging out, retiring, and not having replacements. So it's a perfect storm. It's much more severe than it has been in previous times.
Well, I know that my College of Nursing closed for a while, but they have reopened because of the demand. And I think that's interesting that we do have very good schools that are still open, but we do have a shortage of nurses for faculty.
Absolutely.
Somehow we've got to encourage nurses to stay through their PhDs and master's degrees to be ready to teach our nurses that go beyond just basic nursing. Mm-hmm. And I'm hoping that we can get some legislation that would help to keep them in school, because nurses do work hard. Mm-hmm. It's hardly ever a chance for working on a second job, and certainly if they're going to school, it's not the routine curriculum. It's kind of difficult, so It's very hard. So
we've had trouble attracting faculty in past few years because their salaries are significantly less than those working in the clinical arena, and it's just not competitive. And I think for going forward, in addition to looking at other opportunities to invest in them, through scholarships and loan forgiveness programs, we also need to look at faculty salaries, something that will keep them, or attract them first of all, and then keep them in those positions.
Yes. Tell me a bit about what the organization does on behalf of nurses besides speaking up for them.
Well, that's the biggest thing, is educating both the public and legislators, both at the federal level and state level, as to what some of the issues are that nurses are facing today. And part of our shortage is actually, it's cyclical, but part of it is related to workplace issues. Mm-hmm. Things like mandatory overtime, unsafe staffing, workplace violence, manual lifting that has resulted in nurses ranking 5th consistently for the last several years as the type of employee that has experienced musculoskeletal disorders, and ultimately putting them out of work, resulting in chronic pain. Mm-hmm. So until we tackle some of those issues, we're not going to be able to retain our nurses, and at the same time not going to be able to recruit new individuals to come into the profession.
Well, that seems to be true. I know that a number of nurses that came along about with me, and some a little after, have left nursing and gone into law. Mm-hmm. and become attorneys because of seeing some things they didn't think were quite right. And so they were getting to the point where they could defend other nurses. Nursing is not a routine type of curriculum. It requires a little bit more to enter and to keep up with the pace. Describe a little bit of that for us.
Sure. Well, nursing is an applied science and art, so we really need to have someone who's very strong in the sciences, social sciences, physical sciences, and so it is pretty rigorous. But what is good about nursing is that you have multiple opportunities for entry into the profession. You can enter through a hospital-based program. There are still many of them left in the country. They offer either a diploma or an associate degree in nursing. You can enter through a university, a baccalaureate degree, and come out with a baccalaureate degree in nursing, or a bachelor's in science with a major in nursing. And you could go right on through and get your master's degree initially. But most people choose, about 60% of the nurses in this country do choose the associate degree program, community college program, or diploma, and that is makes them eligible at that point in time to sit for their licensing exam. So it's a lot to put into. They're all taking the same licensing exam, but it's a lot to put into 2 years of curriculum for individuals, again, sitting for the same exam as those in a university setting. It's very rigorous, and it includes clinical component, which is also challenging now too, as healthcare facilities have downsized. Schools are now competing for clinical space, and so that's another challenge that the profession is facing, is making sure that we have adequate clinical experience for our new graduates.
Well, there is a definite difference between the community college associate arts degree and the bachelor's degree nurse, but they're both needed so badly until it's almost gotten that kind of faded into the woodwork. But you can tell, at least as a nurse, when you're in a hospital, you can tell which one has what.
Absolutely. The baccalaureate prepared nurse has a greater depth and breadth of knowledge. Many more of the sciences are included in the curriculum. They don't have more clinical hours, but it gets its depth and breadth of the theory that helps them in making decisions. And that's what nurses do. I think one of the things that I know as a professional, and I've been doing this for 39 years this year, we've not done well, and that's explained what makes us different from other healthcare providers, or what makes the difference between RNs and LPNs and nurses' aides. And the hardest thing to describe for folks is it's beyond the physical tasks. It's not just the passing out of medications. It's the thinking, it's the decision-making, it's the analyzing before decision is made. It's the things that people can't see that make registered nurses different. And so that's the one message that I would like to get across to the public and legislators, that this is what makes us different.
That's true. But patients can figure it out, because the registered nurses, professional nurses, have the highest rate percentage of approval than any other profession. So patients usually can figure out which one knows more about what they're doing.
We're very fortunate to have that level of trust, and we want to continue to maintain that level of trust going forward.
Now, what kind of training does it require for an advanced practice registered nurse?
Well, this gets a little more complicated, but because we have 4 categories of advanced practice registered nurses. I'll start with probably the one that's most commonly known, and that's the certified nurse practitioner. These individuals are nurses who have achieved a master's degree in nursing, and then have become certified by a nationally recognized body in a specific area of practice. And the states vary a little bit, but most of them have the ability to diagnose, allow them to diagnose, make medical diagnoses, and have prescriptive authority for both treatments and medications. And there are some restrictions, again, from that point forward in the various states as to what they can prescribe. So that's one category, the nurse practitioner. Another category is the clinical nurse specialist, and these are individuals also master's prepared in a particular area and they're designed to care for a specific population of patients. So the individual might be a clinical nurse specialist in diabetes or cardiac care, something of that sort. And they typically work in a hospital setting or a nursing home. Another category is the certified nurse midwife. And as typically,